Okay, I think we probably have a lot of people through already. So good morning. We hope everybody's enjoying this conference. There's been a lot of dynamic sessions. Social protection is being stretched in many different directions, and now we provide one further avenue of discussion to link the discussion around economic inclusion for the poorest in times of COVID. So this is very much an interactive session with a number of panelists that we have across a number of different domains. I'll introduce those as I go along. We're glad to have Ben Davis here, the Director for the Inclusive Rural Transformation and Gender Equity Division at FAO. Ben will be very well known to many of you, in particular for his work on the cash transfer project with DFID and UNICEF and a number of other organizations. We're also pleased to have Lauren Whitehead, the Director of Technical Assistance at BRAC. And Lauren is in a very unique position of having a bird's eye view on many of the BRAC graduation programs and exploring what's happening there in real time during the COVID-19 response. And then we also welcome Susan Kondoe, the operations manager at the Malawi COMCIP program. So Susan has lots of stories from the front line in terms of managing and leading the operations through COMCIP, and I suppose also engaging with a range of other economic inclusion programs at country level. From my side, my name is Colin. I'm the program manager from the Partnership of Economic Inclusion, hosted by the World Bank. For those of you who don't know, the PEI is a partnership initiative focused on the scale-up of economic inclusion programs. And we were set up as a full multi-donor trust fund just over about 18 months ago within the World Bank, working with our funding partners, Co-Impact, BRAC, as well as GIZ, as well as a number of other technical partners. So I'm going to go pretty nimbly over to the panel, but we just thought maybe let's give this a couple of minutes of framing. And before I get into the framing, just a little bit of housekeeping. There is a Q&A box there. We'll be monitoring the Q&A box. There's also a chat box, so gossip in the chat box and do questions and answers in the Q&A box. And we'll get to your Q&As in the course of the session and leave time towards the end of the session. We're keeping the session to 1 hour. The focus of this session is the interlinkages between economic inclusion. Economic inclusion, we provided a definition here, looking at the gradual integration of individuals and households into broader economic development processes. And we'll take a particular focus at bundles of multidimensional programs to improve the income and assets of extremely poor people and how this can be scaled up at national level. And the key question really for today's session is how these programs can be built onto, not replacing social assistance programs, but how can we move forward and take a look at the opportunities and challenges in terms of building on these systems of support to get improved productive outcomes around the investments that are happening across the world. I'm going to provide just 3 slides before getting to our panelists. We at the PEI have recently just launched a report preview on the State of Economic Inclusion report. And I just wanted to lead off with a couple of interesting slides and graphics which shows the distribution of economic inclusion programs by beneficiaries and regions across the world. And we have a number of interesting caveats here to show a very strong drive. We did a very interesting survey and benchmarked these programs across 200 plus programs across 75 countries. This is a lower bound estimate. We looked at the spread of these programs led by both non-governmental and government organizations to see a very active presence by both, but a very strong push on government-led programs covering a large share of beneficiaries. And then we also explored the question around what was the foundation upon which many of these programs in this scenario for the extreme poor were being built. And there's a very strong focus there that you can see in the blue around the safety net programs and what this implies. These economic inclusion programs had a number of different components. They weren't just based on 1 or 2 interventions, but had the multiplicity of interventions covering skills and mentoring, business support, access to financial services, and so on. So there's this drive, and what does this drive mean in terms of its complexity across a multi-dimensional response, I think will be a key focus amongst the panel today. And I suppose one of the questions we saw was the relevance for these interventions across vulnerable groups. So whether we tracked these programs to look at who are coming in terms of the poverty thresholds, as well as in terms of the categorical distribution. So a very strong push on women and youth, as well as looking at the benefits for persons with disabilities. But of course, the focus for the panel today, and where I think the panel will pick up and where I will stop talking, really explores the implications of COVID-19 for economic inclusion programs. So we know that the poorest populations will be extremely strongly affected. We know that there are openings and in dialogue around the new PUR and what this means in new contexts. And there are many different dimensions of this debate that rapidly require unpacking. And generally, as we look at these economic inclusion programs, we see a double-edged sword. We see an imperative to respond in the real time and to adjust and to course correct, but then we also see an opportunity coming down the pipeline in terms of really trying to position these operations and really think afresh in terms of how they could be responding more towards a medium-term strategy. So the dimensions that we have here pull out of a note that UK Aid and GIZ are just in the closing stages of pulling together on informal workforce, urban areas, gender delivery systems. Lots of these dimensions are explored. But let me stop here and maybe let me just pose an introductory question to the panel. And I'd like to start off with Susan, and then we'll move to Ben, and we'll move to Lauren in that order. And the first question really asks you to just provide a little bit of a reflection of when we think about economic inclusion, even before we get to the social protection systems and the social protection responses, and how economic inclusion programs might respond to this COVID-19 pandemic. What are you seeing at country level? What are you seeing across your organizations? And where do you see the major directions at this stage? Are there true opportunities, or is there a lot of fanfare and little substance? I think these are the questions we'd like to pose to you today. So over to you, Susan, and we hope your connection from Lilongwe is good. Susan, I think you might be on mute. I think we can hear you now.
Hello?
Perfect.
Yeah, fine. Yeah. So the economic inclusion currently in our country and my institution, of course, when it comes to, you said it shouldn't be related to social protection, but just economic inclusion as a whole. Yeah, it has got an impact, and from the time, based on the time that we've just been passing through, especially on the COVID-19 pandemic, which has had adverse effects on the economic inclusion part in Malawi, I believe when I look at the direction we are going, I can foresee that we still have some challenges, and it may take us a bit longer to recover. And especially when we look at the social protection side, where especially in my case, in line with the rural population that I normally work with, because COMSIP works with the ultra poor in the rural and peri-urban, but mostly in the rural areas. And when we look at the poverty levels and look at the impact of the COVID-19, we've seen that quite a number of issues have happened, and we've had quite a number of things that have come up because of the COVID-19. COVID-19 has really affected quite a number of things, and economically, especially when you look at the women, especially because in my organization, I work with almost 85% women. And when you look at the youth, it's almost about 65%, 45 to about 60%. We've had quite a number of challenges that we faced, and the direction I'm looking at is that we'll still struggle up to close maybe mid next year or even end next year, because economically it has affected quite a number of issues, because the beneficiaries who I normally work with do petty businesses. The income generating activities are mainly small businesses. And even when it comes to skills activities, they are very limited. And we've already seen the impact over the period of 5 months that we've been hit by the pandemic. And we've seen most of the businesses closing, whereby majority of these members rely on support from government now. And to revive that so that they are able to do it again and maybe become resilient on their own, it will be another tough time. because we have to start all over. And this will even deal with mindset change. Normally, I deal with mindset change when we're dealing with these beneficiaries, and that's the best tool we've been using. And currently, we have to go back and start all over again. And because of that, even those that are into agribusiness, that is actual farming, which is another major activity that they normally deal with, where they normally earn a living, we still have quite a big impact because the market itself has been affected as well. So we've had beneficiaries, or maybe we've had members in this year who were able to harvest something from their fields, but they had nowhere to sell their products, the produce to. And even where we come in with our market linkages as an institution, we still had some challenges because even us as an institution, we were not able to go around and do the marketing for them. We were so limited on that. And for even the economy of this country to recover, especially for these rural members, or maybe the farmers, the rural farmers that we normally work with, the smallholder farmers, it will take us time. And I know that this year, even when it comes to farming, we'll have a struggle to come up with these farmers accessing agricultural inputs for them to produce something that they can use. They can, even for consumption, it would be quite tough for them. So that's what I could start with. I could foresee that we'll still be struggling for the next 8 to 12 months. That's the direction I'm seeing, and we really need to look at how best we can handle this in order to get something, maybe to improve the situation that is being there. Otherwise, these will rely mainly on the cash transfers that they're supposed to get. Sure.
Susan, thanks for that. I mean, Ben, to pick up from Susan's point, I think we're reminded a little bit that this is not just a pandemic we're dealing with across many countries. We're dealing with food systems being disrupted. We're dealing with humanitarian crises unfolding at the same time. So from the perspective of FAO, how are you seeing things on this agenda?
Yeah, well, thanks, Colin, and also thanks for the opportunity to be here. Just picking up on what Susan was saying, it's almost hard to even begin to think about economic inclusion without first thinking about the fact that the nature of this crisis is such a large covariate shock that you need the social protection and the cash, one, just for the immediate protection, but also to jumpstart and get demand going again, right? So it's hard to think about the economy moving again without those initial policies, which I think a lot of countries are doing. So we need to stimulate the demand. And I think also adding to what Susan is talking about in the context of other countries is just that there's particularly those countries with a lot of migration, return migrants, there's big return to rural areas of migrants, it's leading to an even more complicated situation because you have just a lot more people, a bigger supply of labor, and people looking to what to do. I think, and so people need jobs basically, right? And so you need jobs now, and I think you need big policies for the jobs. So it's not only just small projects, whatever. You need big economic policies to stimulate the economy and get jobs going. Now, going back to your initial statement, I think was very important in terms of these trade-offs, right? There are trade-offs when we look, and again, we're looking towards a process of building back supposedly better. There is a big trade-off between kind of, these immediate responses, which to get people back to work, and the need to think about, okay, what is that process of, what do we want to build back towards? Given the nature of the shock. Now, I think one particular thing about COVID is that it's exacerbated existing inequalities in rural areas. It's made them even worse, right? And so I think I don't think that, I think we're going to have a hard time attenuating the very negative poverty aspects without addressing the fact that the poverty that inequality has gotten worse. And here, along the different dimensions, whether it's around women and the ability of women to participate in the labor force, or others who don't have access to productive assets or have had their productive assets reduced in dealing with the et cetera, right? And so, I think unless those are specifically included in the way we respond, we can't aspire, let's say, to a process which is actually going to be able to. We're going to build back towards a situation where people are going to be structurally much poorer than they were at the beginning of the crisis, right? I also think we need to look forward to it, as you brought up, in terms of what we're looking for. And this is where kind of the looking at the food systems, let's say the food system transformation is so important, particularly in rural areas, right? Because we're building back into a context where the parameters of economic development and the growth process have changed, right? And as you started out in the beginning, economic inclusion is about, people being part of an inclusive process of economic development. But the nature of that economic development is different now than it was 20, 30 years ago, right? And so we have they're very hard constraints, whether it's in terms of environmental sustainability, whether it's in terms of, expanding, land area versus, deforestation, access to water, the implications of climate change, et cetera. Those are very strict constraints. There's also the big constraints around, changes in production systems responding to diets and what have you, in terms of moving towards a more healthy diet and dealing with, NDCs and obesity and so these are kind of the big development narratives that we're seeing. These are the big constraints that economic development will face. And then you need to balance that with actually pathways which will bring, people out of poverty and address, the great, distributional inequalities and what have you. And so it's a much more complex return, and we need to be careful about kind of immediate responses which may have negative consequences along a number of these dimensions. I mean, that's kind of the big picture, let's say. Thanks. Yep, you're muted there.
I think everybody was just muted. Thanks, Ben. I'm going to switch to Lauren, but I'm going to leave Ben and Susan just with a question to reflect on for a few seconds, and then we'll go back to you. How do you see the politics of it all? I mean, we've had kind of a very nice, I suppose, discussion at the technical level, but we see, I suppose, in a lot of dialogue across countries, attention has shifted, for example, to the NUPR, to the urban space. So are there competing priorities here in terms of, okay, these general population groups who are already chronically poor, just getting left behind, who are already excluded and at the margins? How do you see the politics of that and some of the country engagement that you are seeing, or even Susan, as you engage across different ministries and you just see this central trade-off around a massive demand and a massive need to prioritize agendas? Maybe before we get to the social protection discussion, I'd like to probe Ben and Susan on that a little bit, but let's pass over the floor to Lauren for some reflections, Lauren, on your side in terms of how you're seeing this general agenda with BRAC, and indeed any of the politics that you might be seeing around it too, that you could speak towards.
Sure, thanks, Colin. And actually, I was going to respond a little bit thinking about some of the overall trends that you were mentioning in the beginning, and particularly on the slide, looking at a number of different areas that have become more salient. And I think at this time, one that we've focused a lot on, both within BRAC's own programming, but then as well with a number of our government partners, is particularly looking at this reverse swell of migration from urban to rural areas and the implications that that has for governments, both at national and local level, who are looking to provide some sort of supports and looking to expand their reach to this new poor group, but a new poor group that is highly heterogeneous from previous groups that they may have been serving. So if you think about a number of the social protection programs and systems that have been really structured around rural poverty and really structured around ensuring that there are supports that are provided for the hardest to reach populations, and particularly that those populations have certain characteristics in addition to being hard to reach and having low skills base or having lack of access to training, lack of access to markets, being in very remote geographic confines and so forth. But then you have this swell of the migration that's flowing back to these areas that is much more highly skilled, for example, that has much more experience, has greater expertise, creates competitions in what are already very fragile market systems in those areas that they're going to. And then that's not even to talk about the health repercussions of what some of these flows have created. And we've seen this, for example, in India. I think that's a really prime example. And I think one of the things that we've seen as a trend emerging as a result of this is this need to really understand better, especially considering that this crisis is going to be so prolonged, and that what once may have seemed like a short-term acute humanitarian response that now has become something that's going to be more protracted in nature has put a lot of pressure and strain, obviously on resources, but also on just planning for this type of provision. So if we're thinking about something from the nature of previous programs having been designed better for certain types of populations or cater towards certain vulnerable groups, and now having to pivot that, where do you get that information from? How do you understand what these heterogeneous needs are, and how those needs can best be accounted for within the existing systems and outside of those systems as well? So I think one thing that we're seeing a lot of with a number of the governments that we're engaging with is a focus on better rapid welfare assessments and how you can conduct rapid, periodic, even episodic welfare assessments to see where the trends are moving in terms of how different populations are impacted. Because if it takes a certain amount of time to mobilize resources for a certain group, for a particular area of focus that you think, for example, we're thinking about cash transfers for food insecurity, however, the need has actually moved and the need has actually shifted because you have a certain population that's able to tap into opportunities that others aren't. How are you able to respond to that quickly? So I would say in Bangladesh, for example, when we conducted a number of rapid welfare assessments early on during the pandemic and have continued to do that, we've seen as many as 95% of participants who've been in economic inclusion programs who were able to sort of pivot and respond with their livelihoods in one way or another. And what we're looking at is how can those lessons be actually transferred to others who weren't necessarily involved in some of those economic inclusion programs to begin with. What are the lessons learned from those groups who've been able to do that more quickly, and how can that be transferred? In the Philippines, for example, with working in a program with the government of Philippines and the Department of Labor and Employment, they've seen a similar trend where around 89% of households were able to maintain certain versions of livelihoods. 96% of households were able to actually access social assistance from the government. And so now they're asking the question of, okay, well, we see that there is something that's working for certain populations. Is that going to be necessary for a lot of these returned migrants who are flooding back into the country, who can no longer be in places where they were working previously, or do we need to actually tailor that? So part of what we're working on with them is using the information that's coming out of some of these rapid diagnostic surveys and then creating more systems around digitization of a lot of that information so that you can have rapid real-time responses. So in the Philippines, they actually already had a system that we had worked with them to set up. So they were able to very quickly kind of assess what the needs were and then respond immediately, almost immediately, in terms of gearing people towards certain market opportunities that they might not have known were there, or actually steering people towards certain types of government assistance, which connects to another theme around local government. A lot of the focus has obviously been on national government, national systems, given their broad reach and mandate. But what we're seeing a lot of, and particularly in countries where we're working, for example, in Egypt, is you're seeing strong localized government support, whether that's coming from something like community development associations that already had sort of their own mission and mandates to serve their local communities, but are better able to assess some of those needs real time as well. So they're able to help provide supplemental food support. They're able to mobilize to bring in additional sort of cash transfers at the localized level. We even saw barangay community councils in the Philippines who were able to provide health messaging and health support to certain households with community health workers who were dispatched to areas where there was highest need. So we're finding that, yes, it's a lot about understanding this new population and this population that governments are now seeing they're going to have to work with longer, while ensuring that the original vulnerable groups that they were serving are still well cared for and still have their needs necessarily met. And I think something that we're probably going to see a lot more of, particularly as this continues on and we get a better sense of the profile of the poor and this kind of heterogeneous mix of needs, is that many of the programs going forward are going to have to start responding with a more targeted approach. And I think the initial response has been quite widespread and universal for necessary reasons. And I think a lot of that will continue. But I think further, with some of the constraints that are met with resources and so forth, and the politics, as you alluded to already, there's going to be a lot more targeted supports in different ways to different groups. So I'd stop there for now.
Lauren, I think it would be great towards the end in our third block of discussion to return a little bit to these market and welfare assessments that you've been doing. Maybe walk us through a little bit briefly on those and tell us also where we can get some more information. I know there was lots of email traffic recently and newsletters, I think with some preview of information that had come out. But with all of this information that we get from these rapid assessments, we come back to the question of customizing interventions and then the politics of response. So just before moving on generally onto the social protection side and I suppose, the opportunities and challenges around there. Susan and Ben, I'd offer the question back over to you in terms of how are you seeing the politics around this? I guess one message from the PEI and the work that we have been doing is to try and situate this agenda as part of a wider policy response. That's the way that governments have to articulate this as well. But this is complicated in a low resource, low capacity context when we're not only looking at a package of interventions, but now presumably interventions that need to be customized or organized along different priorities that the government will face. Ben and Susan, I'll offer the microphone back to one of you, or both of you.
Okay, let me start. When we look at the situation currently, I'll just add on some other issues that were said by Lauren and Ben. The issue is the situation itself, the condition itself, the pandemic itself has brought in quite a number of issues. And it has brought a lot of pressure on the limited resources that have been available. And has these resources we may talk of health resources, education resources, and we've seen a lot of maybe migration from the rural areas coming to urban areas. And in Malawi currently, the ones that have mostly been affected are the ones that are in the urban areas. And we've seen quite a number of, quite some pressure in the urban areas and among the urban population. And this is where we've heavily been hit. And when you look at the situation itself, you'd see that there are some dynamics that are taking place. You'd see when you look at gender-wise things like those, you'd see that mostly it's women that are being affected in the urban areas, mainly because of the usual issues that normally happens. We have quite a number of female-headed households in Malawi, especially in the urban areas. And you'd see that even these female-headed households, the dependency ratio is quite high. And for these women, maybe to support these households, based on maybe the small activities or businesses that they're operating in town, will be selling small things, fruits, things are going around in the pandemic. That means they can't do that. There isn't that freedom. And maybe to get food for the day, it's becoming hard for them. And we've seen quite a number of trends that have been happening for the past 6 months. You'd see maybe drop out from school. Yes, we've opened schools now in Malawi, but you would see that the dropout rate is very high. And we've seen maybe early marriages taking place, and this is very high, especially in the urban areas. We've seen girls getting married just because of the poverty issues and the like, because the situation is now tough. The families, maybe the households can no longer afford to support these kids, and you'd see teenagers getting married as early as 16 years, 17 years, 15 years, girls that have been in school but getting married just because they need support. And such trends are the ones that are bringing quite a lot of pressure on the limited resources and even in government. I work with several ministries and I cross-cut in several ministries of the government. And we've seen this affecting us too much. And we've seen the Minister of Gender struggling on how best they can handle this so that they can bring the girls back to school. Especially for those that maybe are already pregnant and the like, we've had a very high rate of pregnancy among the teenagers during this period, which is quite a big issue. And we've seen the good parties, we've seen government responding to that and trying to find out ways how we can best handle that so that the girls could go back to school and go back to school. And we've seen some special initiatives taking place, deliberate more initiatives to take them back to school and maybe to allow so that those kids can still go there. And currently there is that political will from government to support such situation because there is that understanding regarding the pandemic and the situation that we are in. And the current government understands that the economic inclusion, we can't talk of economic inclusion if we don't look at the social life and other part, or we don't look at the holistic, we don't use the holistic approach when it comes to handling this issue. So we've seen quite a number of initiatives taking place, maybe coming up with programs that would support the ultra poor or the vulnerable who are affected by this pandemic, because maybe they don't have other means, or no, maybe they don't have means how they can prevent the spread of this. And you would see that maybe for them being vulnerable, by the mere fact that they are vulnerable, you see them that chances of them catching the virus and maybe being affected, even affecting the whole household, chances are very high. So there are quite a number of programs that are taking place: sensitization through health initiatives, sensitization through other initiatives, education through all those sectors that are involved. So currently, as I'm talking now, we've seen a trend going down. And this trend shows how teamwork has helped in Malawi. And we believe, as we are working towards controlling this spread of the pandemic, and which has got an impact on the economic situation in Malawi, we believe with time, if we continue the way we are doing, at the rate we are doing, things may change, but it may take us, as I said before, a longer time, close to 8 to 10 months.
Oops, you're muted again there.
Rocky Zoom for me. Ben, I'm going to turn the question over to you, but maybe let me preamble that a little bit. I mean, I'd like to get to the politics of this. I think you're also very well placed to talk about some of these agendas around inclusion and what that means, whether from a gender and a youth perspective. But I guess the central question that we're trying to unpack a little bit over the next half hour is, where does social protection come in, and where does the safety net agenda come in around all of this? So this is like a 3-day or a 1-week SP.org event. Let me be a little bit provocative here. We're looking at the social protection agenda. Is it at risk of being almost like a Christmas tree with lots of things being packed up onto it? So really, what are the true opportunities and challenges as we think around scaling up these programs, and where does the politics start to bite? So Ben, hopefully that's enough roadway for you to lead off with.
Yeah, thanks, Colin. I mean, I think what do I want to say? I mean, I think the crisis in, I mean, the politics of the crisis, right? In terms of social protection, on let's say on the positive side, is that it's made it evident to the world, right, or the world of policymakers and those who are worrying about policy of why social protection exists and the important role that it plays, right? And so I think it certainly has expanded the politics, though. But I think it's also clear that, I mean, the social protection only goes so far, right? And so you, and as you say, it's not a Christmas tree. You can just put everything. In fact, for me, social protection is kind of the base foundation, and then you need to build around it the rest of the system, essentially, right? In order to lead to a more inclusive process of economic development, right? And so it's kind of it's certainly a necessary but not a sufficient condition, right? And you need to build in these other programs, and not integrating necessarily, but coordinating to have a more inclusive process, right? And so I think in terms of the politics of this, I think the crisis has been positive again in ways in exposing certain inequalities and weaknesses of the economic system, and particularly the food system. Particularly, I think, around labor and the role that agricultural workers play, and then informal workers play, their extreme vulnerability, as well as also just the fundamental crucial role that they play, right? So, people all of a sudden were worried, okay, am I going to get food on the table? They actually, they remembered where food comes from in a lot of, let's say, the more developed countries, right? And so it brought into very high, it just made it clear kind of, who are some of the really more vulnerable groups, and how can we address them, and also the weaknesses of social protection in reaching many of these groups. Now, the politics are fundamental in terms of determining how this is going to play out. And I think a crisis like COVID can both expand the possibilities, but can also reduce them, right? I mean, you can see it leads to the rise of authoritarianism and populism, but it also can lead to new spaces and new accepting much more radical policies or policies which aren't really radical, but which didn't really get, normal, like social protection. It's not really a radical policy, but it's much more accepted now, the important role it plays. And I think, where the real political battle is going to be now is really on this process of economic recovery in building back, and the priorities, and who's going to benefit from that process, right? And this is really where it's going to be a tough political fight. And this is, it's going to represent all the political dynamics that we have in all of our countries, in every country, right? There's existing political dynamics which influence that. And I think it's going to be, now I think new coalitions, new forces will emerge. But again, it depends on whether it's more authoritarian or more democratic, no? And so here, I think there's really important roles that we all need to play in terms of, trying to, get information out in this process and in this debate. No?
Colin, would it be a good time for me to jump in on that?
Perfect. Go ahead. Yes.
Thanks. Just picking up on what Ben was mentioning there, and at least earlier in his response, sort of alluding to this need for interministerial coordination, collaboration, a wider reach in that of partners who are collaborating together. I think that's something that we've seen a tremendous amount of need for, even preceding COVID, just recognizing that you call it a Christmas tree with the ministries of social protection. I would completely agree. I love that analogy, just because it seems like there's so much that's just loaded on social protection constantly, as if the Ministry of Social Protection is the only ministry that has any mandate to provide for vulnerable groups or groups who are experiencing poverty, extreme poverty, and so forth. And I think what COVID has made abundantly clear is that there is a much broader based mandate that should have already been adhered to prior to this, to strengthen interministerial, not just coordination, just sort of working around each other, but actual collaboration. Meaning, if you think about something as simple as unified registries, and you ask the question of why don't those exist more frequently? Why isn't it easier for the Ministry of Health to coordinate with the Ministry of Social Protection, or the Ministry of Industry and Trade even to coordinate with ministries of labor and so forth? And I think a lot of that has to do with silos and sort of the nature of budgetary instruments as those are developed within national government and then trickling all the way down to decentralized levels. But there's a tremendous opportunity now, when it's seen that every ministry has some form of a role to play, and that every ministry needs to actually coordinate and collaborate their responses more effectively, because ultimately, if there isn't a holistic response to this, we're going to end up where we were or worse previously, which I think is something that Ben was mentioning, and Susan also said as well, just the erosion of progress that's happened in terms of inequality, in terms of poverty, and so forth. And I think this is now the time for there to be a galvanizing cry for ministries to do that. And I feel that, and maybe this is something provocative to say, but BRAC has very much felt that development partners really also have to help lead that charge, because a lot of why governments find themselves in certain situations and in this place of silos is because the development partners aren't even coordinated to begin with, and therefore the resources, the technical assistance, the support that's being provided isn't necessarily even helping governments when they might have a more collaborative mandate.
So just as I was about to move you on to some of the design features, you did mention this coordination of development partners at country level, and I do recall from my own experience of working in Malawi, where we see terrific progress. It is an example of a country where you have a multiplicity of different interventions happening, sometimes not in a very clearest coordination fashion. And Susan, maybe you could elaborate a little bit more about that and the experiences of actually how you try to draw synergies across different programs. But let's move the conversation a little bit to some of the, while you think about that, to some of the design features of these interventions. So what is different about COVID-19, or is there anything different about COVID-19? Lauren, I'd like to maybe keep the spotlight on you for a little bit. I mean, at BRAC, we refer to classic graduation models, classic graduation approaches, which is a little bit unfair because these approaches have 20 different phases and they've iterated many different times. But what's different about these interventions is that they have a number of different components. So you have cash transfers, in-kind transfers, skills, coaching, linkages to market support. We'll talk a little bit more about market support later. But in the context of COVID-19, are you seeing things that are a little bit different in terms of the program design, in terms of what is immediately happening on the ground, in terms of the interventions that are actually being scaled up? And do you think that this will matter for the long term? And I think similarly in Malawi, we see that the program has been scaled up with a cash transfer response, the FCT program, primarily in rural areas. We're now seeing that shift towards an urban response as well. We might hear a little bit more on the Malawi side too. But Lauren, over to you.
Sure. Did you want Susan to respond on the point around ministerial collaboration first?
I'll give Susan a few moments there to, since I put her on the hot seat, we'll pass over to you first.
Sure, perfect. No, I think this is a really great question. And just like you rightly said, there's been so many iterations of graduation programs. I think one of the key features that we hold most dear, and we as in BRAC in terms of all of our work with governments, is really on the need for adaptation, customization. There really can't be a one size fits all. And I think COVID has actually just brought that a stark reality into greater relief for us as well. And I think something that we've looked a lot at is graduation programs in and of themselves are designed to sort of account for certain areas of market failures, whether those are market failures in actually reaching the poorest, making sure that they have access to vibrant markets that are readily available for their inputs, making sure that they have access to skills training and things of that nature, making sure that they have access to actual market assessments that would tell them from a very localized view what are the best enterprises to engage in, what are the best employment avenues to process on, and so forth, and then having that constant support and guidance to move through the process. And I think right now, what has happened is we already had a strong emphasis on highly localized market assessments, but COVID has pushed that into a direction of hyper-localism, whereby now we're focusing on, yes, market assessments shouldn't necessarily look at what are national trends, because those aren't going to be very applicable for people in this particular region, in this particular geography, et cetera. But if you have a hyper-localized, if you have a localized market assessment to begin with, that's already focused on a very specific region or a province or what have you, then within that, you can actually layer on a hyper-localized response. So for example, I'll just use the government of the Philippines as another example with the Department of Labor and Employment, because we already had a very localized assessment that was done in a particular region. You're able to then very easily go back in and reassess certain value chains and how those value chains have been impacted by COVID. Because with COVID, you're seeing, yes, mobility constraints when it pertains to accessing the market. You're seeing disrupted supply chains, disrupted distribution chains, and so forth. You're also seeing asymmetries in market information for people to actually even know what's accessible right now or know what's viable. And when you already have a localized assessment, it sort of short circuits essentially the process to try to identify among those what are most affected and what can we do to respond. So something that was done immediately for the households who are working, who are within the graduation project in the Philippines, is that they were able to find really quickly, we had livelihoods risk management workshops essentially that were hosted virtually initially. So that was through checking with households via phone and so forth, other digital means. And then when it was safe to do so in a more socially distanced environment, to be able to say, if you're in this situation and you're encountering these challenges, here are 5 different ways that you might respond. So for example, you might have been in a massage therapy business. Well, no one's doing massage therapy businesses in the wake of COVID, but what were the underlying skills that were already assessed for you and your household? And how can you then be geared towards another option? Now, there are many who would say, how can you scale with that? That's so customized, so tailored that you couldn't necessarily scale with it. But what we're actually seeing is not necessarily ignoring what the household's specific needs are and individualized household needs are, but being able to look at households in cohorts, in larger groups. And again, this goes back to what I was saying before, understanding those heterogeneous needs, to be able to say, okay, we do have a large population that may have been engaged in something like swine fattening, which therefore means that they know how to work with small ruminants, which means that they do already have skills training in access to certain types of vendors and suppliers. So how can we then activate those chains during COVID to ensure that they have those backward and forward linkages consistently? And because there are vendor relationships that are identified in a hyper-localized market assessment, you're able to do that fairly quickly. A lot of this, though, is really dependent on, again, working with local government as well, working with local agricultural extension officers, working with local community councils, et cetera, to make sure that there are actually going to be openings for value chains. And I won't go into it, but what that taps into is just thinking about market systems development. And when you're working in these much larger programs that are driven by national government, you have the ability to actually affect market systems development in a way that you never could, even in the earliest generation of graduation programs, where they were just so focused on small pilots. But when you're operating at scale, the potential is tremendous.
My screen jumps around when I press the unmute button. Susan, let's hear a little bit from you just about the actual mechanics and the design around which the COMCIP has been able to move. Just for people who are not familiar with COMCIP, if you could just tell us a little bit about, how you're building on the social cash transfer program. What are the specific modalities to get a flavor? And then maybe we're waking up a little bit. We still seem to have 52 attendees, which we had from the beginning, which is great. You always wonder, are you talking into thin air? We haven't bored people to death, but we do have a couple of questions coming in, and I'm going to maybe do the last 10 minutes focus on some of these Q&A. Ben, there is a question for you in the box around, look, what are the adaptations we're thinking of in a LAC context? Ben, I might kind of try and twist that question around to try and encourage you to talk about some of the market linkages and some of the issues around market linkages we wanted to get to. And then Lauren, there was a question for you, I think from Marco Knowles. I don't see it in front of me, but there was a question around experiences that BRAC actually have working with governments and how BRAC are actually scaling with governments through government programs. What's your experience there? But before we get to you all for some closing reflections, and we really ask people to use the Q&A box, there's a special surprise for the best question, which we can announce at the end of the session. Susan, over to you, just to hear a little bit more about the design of the COMCIP intervention.
Okay, thank you, Colin. I would first of all maybe start with the collaboration that has been there with the different ministries, the one that you tackled in the first place. I believe I just have to explain how it happened. Of course, before this, normally we used to handle everything. Maybe every other stakeholder could handle social protection programs their own way, the way they wanted it. So we saw that there were quite a number of diverse number of maybe interventions that were taking place, but all of them were talking of social protection and maybe how to, is it market linkages or other linkages that are supposed to be there. So government of Malawi, through the Ministry of Economic Planning and Development, came up with a social protection program. We have a policy which we normally follow, and there are pillars that we all fall into. And it is through this that government has tried their best to harmonize the systems and the interventions so that at least we fall within the same. And this is the one that has brought us to working together, the different stakeholders, different ministries collaborating without any problems, such that starting from the center, that is, we work as a team. All stakeholders involved in social protection programs do have input in whatever we are doing. And when it comes to implementation, even coming up back with the results and the like, we normally share experiences and the like, and map the way forward as a team, such that currently we really don't have problems. And we've seen this system working, and we know in the current programs that we'll be having that we are yet to start, it would be the perfect system that we are using. And the collaboration hasn't been a problem. All ministries are willing, and there is that willingness. Before this, others were not all that willing to work with the other parties or other ministries, but currently there is that harmonization. Even when we're working with other partners, the development partners, we don't have problems currently. Everything is done perfectly, and when you look at how we are implementing the activities, we involve all stakeholders, even at the grassroots level. We involve all stakeholders. We have extension workers from different ministries. All of them are involved when it comes to working, so that we have multiple inputs from different sectors. And based on the systems that were put in place using the Malawi National Social Support Program and the 4 pillars that we are leaning on, that's the one that I would say that's our Bible. That's what we are looking. No one has to go outside that. So we all lie on the policy that has been put in place. So coming
Susan,
into how...
Susan,
Yes, yes.
My apologies,
Yes.
but I'm going to, I'm just going to cut in a little bit there, because we do need to finish at 12 and there are some questions coming up, but I will give you a final word, maybe just after a last blitz across the panel. But let me just switch over very quickly and ask others, please submit your Q&A. But Ben, just over to you for a final word, a little bit on these market linkage questions, and over to you.
Sure, no, thanks. And I think what that question gets to, I mean, obviously social protection is, I mean, it's fundamental as the response. And again, it's, as I said before, you need to have a solid social protection system, right? But that's just the beginning. I think one lesson that we've learned from Latin America is that the coordination between the different ministries around, let's say, a coordinated approach has been a big fat failure, no, in almost all countries. The incentives are not aligned. You know, the ministries have different focus. They don't want to focus on, many of the ministries of agriculture don't want to focus on the most vulnerable. And the ministries of social protection certainly do not have the capacity to have on the technical side of economic inclusion, right? And so there is a major interinstitutional coordination failure, basically, let's say, I think in a lot of, particularly in the region. This is a region with, with very, mature social protection programs, let's say, right? And so I think what it means is that, we need to have a focus on inclusive economic development that isn't predicated on, integrated programs between social protection, and I think it needs to be predicated on a functioning system which covers basic risks and covers basic, the basic things that social protection systems need to cover. And then you have a focus on rural development, economic development, which is inclusive in nature. Now, but that really requires changing a lot of the parameters of the economic system. If we look at rural areas, which of course is what we focus on, it's about changing, the price incentives, it's about changing the subsidies, it's about changing the market access, as you were saying, key issues around market access and making markets more accessible to smaller scale producers, what have you, which these are all fundamental. I mean, they're all fundamental for more inclusive processes of development, but again, these are also political struggles that need to take place within the ministries of agriculture, within the ministries of, let's say, development and economic planning, right? But again, it can't be. I think we have to start moving away, particularly in some parts of the world, to this idea that we're going to combine every social protection program with an economic development program and a livelihood program, because it works in some places, but it doesn't work in other places, right? And so I think we have to, go by, we have to look at the political economy, and really the institutional context drives, I think, a lot of the approaches we have.
Thank you, Ben. Lauren, over to you for a final word, and then Susan will give you a final word since you're at the front end, and maybe you could have some inspiring guidance for so many people who are trying to implement these programs and think through a redesign at this stage. But some closing thoughts, over to you, Lauren.
Sure. I think, so I hear Ben's concerns, particularly when it comes to layering, and I think I've heard these concerns echoed many times before, because social protection systems, as we said before, have been very burdened, and in particularly areas where you have very nascent or fledgling social protection systems that are being developed, there is a concern of essentially adding too many ornaments to the Christmas tree, and ending up in a situation where nothing is actually done quite well because there's too much of an emphasis on spreading reach and not necessarily being able to concentrate on some of those core elements. And I would say that is a big part of why we talk about tailor-made responses. Not every country is going to be ready for the same type of economic inclusion interventions that another country might be prepared for. There are different ways to create long-term roadmaps, essentially, to saying we are starting here, but we are aiming to end up there, which is very different from saying we are starting here and this is all we will ever do, this is all we can ever achieve. I think that's actually can be quite limiting in some ways. And I think when you're actually designing for these thoughts and in the process and kind of embedding and integrating what certain elements would need to be, for example, unified registries, for example, increasing decentralized capacity building within local government counterparts. I think about the situation in Rwanda, where they had a wonderful experiment implementing the minimum package for graduation and learned a tremendous amount that is now being incorporated into a national strategy. And a lot of that national strategy is going to be predicated upon upon strengthening the Vision 2020 Umurenge program, which is their core flagship social protection program, so that they're able to integrate other elements around economic inclusion for those who are best prepared. Even if we look at the government of Ethiopia, and PSNP, which has been the productive safety nets program in Ethiopia, which has been one of the initial programs that was thought to be a flagship, melding cash transfers and economic inclusion in something akin to a graduation approach. And even they're looking at how can we better focus our resources so that we know that there are certain things that we are able to do quite well for a broad base. Both rural populations and urban populations are actually exploring now. And for particular groups who exhibit certain characteristics, how can we help accelerate their progress out of poverty over time, right? So I would say, to close, shall I? In closing, I would just say that there is tremendous opportunity that's here, and a lot of it is about diagnosing and meeting the system where it's at, and then building in those elements so that it can actually grow in the direction we think will be most promising.
Super. Thank you, Lauren. Susan, I'm going to give you a 1 minute challenge to close us off in time. And I need 1 minute to give some promotion things also for an FAO session tomorrow. But Susan, over to you.
Okay, fine, Collins. I would say that when you look at the scaling up for this social protection program, there is no standard way where you can do that.
Can you hear?
I think Susan froze.
Okay. Let's see if Susan comes back in. But look, in the interests of time, Susan, can you hear us now?
Normally, it depends on which country and things like the gesture of the cash, and maybe because that is the yeah.
Oh. Susan, hi. Thank you, Susan. I'm going to just maybe have Sandas summarize a couple of your bullets there because we lost connectivity at the last moment. But I do want to thank everybody. We're coming up to the hour where we do need to go. I promised a prize for the best question. I think it was a draw across our 2 Q&As. This does allow me to give a little bit of a helpful nudge to a report preview on the state of economic inclusion that PEI and many of our technical partners developed over the last year, which has just been released, and the final report is coming out soon. There's a couple of sessions coming up next on digital solutions for SP responses and bridging the disability gap. So log online and go to those sessions. And then some really interesting discussions tomorrow on October 7th, side events in particular on linking SP and resilience agriculture. I know there's 3 country presentations there, including the PSNP in Ethiopia that we just discussed, and a number of other interesting sessions. I really want to close by thanking Sandas and Courtney for the groundwork on all of this session, and many other people from the respective teams of BRAC and PEI. But most of all for thanking Ben and Lauren and Susan for sharing your time and sharing your expertise. I'm not going to summarize it, but it's been a very, I think, enriching discussion, I hope, which allows people to maybe just pick off and to contact anybody in the panel if you'd like to learn or hear more information from anybody.
Thanks very much, Colin.
Okay.
Nice
Have a good evening, everybody.
Everyone, thank you.
Bye-bye.
Bye-bye.
Thank you.